Good morning. I'm going to focus on the inner circle that you saw earlier related to the informal support surrounding caregivers. It's worth mentioning just again that when asked what their most important resource was, 62% of caregivers explicitly described the support from their family, friends, and neighbors as an important resource. So as Krysten mentioned, the main charge of our research was to better understand what these informal networks of support look like, who's involved, what are they helping with, and what does this really mean for caregivers? How is it impacting their lives? So I'm going to start by presenting 4 general findings about informal support from our survey. And I'm going to share both the strength of that finding as well as a limitation. And as we go through these slides, let's all take note that these limitations are really the opportunities that we have to strengthen informal support networks. So the first one up here is that 85% of our caregivers reported help from at least one person. And that person was usually another family member. However, that leaves 15% that said no one was helping them, and that 85% includes about half who rely solely on one other person to help them in their caregiving role. If something were to happen and that person was no longer available to them, where would that leave that caregiver in terms of informal support? Next, 79% of caregivers said that someone could take over for up to a week with their caregiving responsibilities if they were faced with a crisis or in a situation they needed to take care of. But when we asked about longer periods of time for this backup support, we see a fall off. Just over half said this support could be available for a month or two, and 42% said this backup support would be available to them for an indefinite period of time. This was echoed in some of the worries that we heard from caregivers. If something were to happen to me, where would that leave my care recipient? Just over 3/4 had reached out to somebody in their life to help them with their caregiving responsibilities, and most who asked did receive that help. However, for 15% of caregivers, they reached out but did not get the help that they asked for. An additional 30% said they felt that other family members could be helping them with the responsibilities but were not. We asked those caregivers that felt that way an additional follow-up question and as to the reasons why they felt that way. And what we heard was some personal feelings about not wanting to burden others in their life by involving them in the process. We also saw some family dynamics pop up, strained relationships between adult siblings, and not wanting, again, to interfere with other family responsibilities they had. And then just over, 57% said that they received help with a specific task in the past month related to their caregiving. But within that 57%, 29%, this meant one task. And as Greg pointed out earlier, our primary caregivers are helping with a wide range of tasks on a regular basis. So that finding in context reveals that maybe reaching out for specific help with tasks is an opportunity for caregivers to maximize their networks. So we took a number of approaches in being able to describe and understand the experiences of caregivers, the informal support that they had in place. The first one that I'd like to talk about is this idea of an informal support network. So not just looking at the variety of information we collected about informal support, but how do those indicators layer and form an actual network of support around caregivers? What is their collective strength? To do that, we narrowed down all of the information we collected about informal support to 8 items to include in a scale. We did a simple approach to the scale. We simply summed up, for example, the number of family members. Somebody who had one person helping received a score of 1. Someone who had 2 or more received a score of 2. And someone who had no one helping received a 0 on that particular item. And that similar process was applied to all 8 items in the scale. These 8 items fell generally into 3 categories. This first category, help with caregiving tasks. This refers to the instrumental support that caregivers receive, that direct, tangible assistance. So we see the number of people helping, the specific tasks that they're helping with, and then we added that piece about long-term backup support. Next was reaching out for support. So how are caregivers active in creating informal support for themselves. This involved leveraging existing relationships, so successfully enlisting others in their lives to help, using community activities they participate in as resources, and then gathering information from a variety of sources. And lastly, emotional support. Fairly self-explanatory, but we defined it here as frequent contact with a close friend or family member about their caregiving role. So about a quarter of our caregivers had a high score on our scale. 44% had moderate scores, and about a third, 31%, had lower scores. So what exactly does that mean? What did we see in terms of what these caregivers with high, low, and moderate scores look like? Here there's a profile of those who had a lower score, indicating less informal support in their lives. This was 37 caregivers. We saw more men than women in this group. They were less likely to be working, more likely to be lower income households, and to share their residence with the older adult they care for. And husbands, sons, and non-relatives were represented in this group. In terms of their caregiving role, they were more likely to feel that this role was expected of them. They had a higher demand. So actually, this group spent about 55 hours per week on average in their caregiving role. They were also helping with a high number of tasks, and just over half were using home-based services. So those who had higher scores on our scale, indicating more informal support in their lives, this was 29 caregivers, more likely to be women. They were working, they were caring for others, they were not living with the older adult they were providing care to. And this group was primarily daughters, some wives, and a few other caregivers as well. They were spending on average 39 hours per week providing care and helping with fewer tasks. Interestingly, a significant proportion of these caregivers had spent 6 or more years as a caregiver. And then 60% were using home-based services. So this slide brings up some interesting points, which is the question of, did a strong informal support network allow them to continue to work and care for others? Or, on the other side of that, did they have to go out and build this informal support network to accommodate these other commitments? So we looked at these, our low-scoring and high-scoring caregivers in terms of some signs of distress, and we found 3 statistically significant relationships. The first was related to self-reported health. We found that those with lower scores were more likely to say that their health was fair or poor. They were also more likely to say that their caregiving role was very stressful. And lastly, we saw a reduction in time in activities outside of the home. So if you had a lower informal support score. The next way that we looked at, or the next question I should say, that we examined regarding informal support and understanding caregivers and their experiences, we focused on one key item from our scale, which was this question of who was helping caregivers. So moving beyond just the number of people engaged in their network, but who are they, and would we be able to see some patterns about who caregivers were involving in that help? So we did see 4 categories. I'm going to discuss the first 3 with you. So again, I mentioned earlier the 15% who don't receive help from anybody else. Those are our solitary caregivers. And then our largest group is caregivers who are only receiving help within their family. This was just over half of our caregivers, and this usually meant one other family member. So a very common configuration here was, for example, an adult daughter who was caring for her parents and had other siblings engaged in that process. Last, there was a group who had help both within and outside of their family. And help outside of the family meant a friend, a coworker, a neighbor, a member of their faith community. And this particular group, we termed them as having extended support. And this particular group, 25% of the primary caregivers, we saw lower signs of distress as measured by self-reported health and stress. So this particular group was doing slightly better than those who were receiving help just within their family. Lastly, we looked at the relationship of caregivers to who they provide care to. In the growing body of research about caregiving, it's well established that the experience of spouses and adult children vary greatly, as do the experiences of son caregivers versus daughter caregivers. So we wanted to understand if the caregivers in our sample had shared these differences, and also use that lens to look at their informal support networks and better understand what the differences are. So that's our array of relationships. And in doing so, in looking at caregivers by who they are providing care to, we were able to identify some key challenges. We certainly don't mean to overgeneralize, and we understand that not every spouse or daughter or son shares the same challenge, but we were able to pick out some key themes. The first is that the key challenge for spouses was that caring for their partner was a 24-hour-a-day job, and their levels of distress were very high. For daughters, the key challenge seemed to be balance. So they were working more often, they were caring for others, and having time for all of those commitments and responsibilities. Sons were more often, as Greg mentioned earlier, they were more often living with the parent they were providing care to. Something we heard in their interviews and their open-ended responses pointed to the fact that they wanted to make sure they were doing everything they could, they were making the right decisions for their parent, especially concerning medical resources. And then for friends or neighbors, they are stepping up oftentimes because no one else is there to help provide care to an older adult. And so some of them were not very well positioned or equipped to take on that role. They had health limitations themselves, they were spending a lot of time providing care, and they had fewer resources in place to help them. So applying this idea of who the caregiver is in relation to their informal support networks, there's a lot of information on this slide, but I think some of the key points are that both spouses and sons are not really engaging members outside of their family when it comes to informal support. And as we saw earlier, doing that could really potentially help lessen their stress and improved or had a better association with self-reported health. And daughters specifically, they're good at engaging others outside their family, and they're good at using the resources in the community to support their caregiving. But when we asked them about specific tasks others had helped them with, they were less likely to name a specific task. And that might just point to the fact that they were receiving a lot of emotional support and not delegating really specific things to others. And lastly, friends or neighbors, they are getting that kind of help. They are asking folks to do specific tasks for them, and they're gathering information, but they are lacking in emotional and long-term backup support. So the key findings from these three ways of grouping caregivers is that informal support is making a huge difference in the lives of caregivers. They have fewer signs of distress, which include better self-reported health and reduced stress. Engaging someone outside of their family seemed to really make a difference as well. Having both someone within the family and outside the family as part of their informal network was a key difference. And lastly, we did find that for our caregivers in our sample, the caregiver experiences did differ, and as do what their informal support looked like and the opportunities to strengthen them.